I had been involved with other businesses, different parts of the country, and I was in Los Angeles, and I just was really challenged by the work ethic that I found from a lot of the employees I had, and decided to move it back here to La Crosse, and I've been here ever since. And La Crosse has, I mean, it has so much to offer. One of the concerns my board had originally, because we expected to grow considerably over the years, was whether or not we were going to have be able to find the talent, the kind of resources we would need to grow the company. And I really pushed back on that. They really thought at one point we should look elsewhere. And we have had no problem with that at all. Today we have over 900 people who work for LHI. I think in the next few months we'll be hiring our employee 1,000. And I just looked up today with HR, 48.9% of our employees have either graduated or are currently attending one of the colleges and universities from the area. We have great schools, so we're keeping a lot of the young talent here, where otherwise, you know, they move on. There's not, you know, opportunities like they have or are looking for. So we keep those brilliant young minds here. 80% of our employees are 20 to 40. Starting out their careers, their families. It's a wholesome area, great schools, and some of the best health care you're going to find in the country. People here are very hardworking, very loyal, and it makes it very competitive for us to grow and build businesses here. The engine of this company is it's proprietary software that we have created, and how we manage the medical readiness for, you know, the service members and other railroads and other clients of ours, and the knowledge that we have. I mean, everything is going today, it's going paperless, and information is very important, and how we manage that. I mean, we can, on any particular week or weekend, we can provide almost 300,000 services to, you know, at say 250 different locations all over the United States, the territories. They have that information to get all of the supplies, to get the resources, to get the talent out there, you know, and how we manage that, how we figured all that out. And then you have to know, if we have, you know, if we had 10,000 service members that we're providing, you know, these services to, whether it's medical or dental or whether it's hearing, vaccinations, you need to have that information. It has to be accurate. And how we manage all that is very, very unique. And it's taken us to the next level. Taking care of our employees, very low turnover, employees who are loyal. You can't put a price on loyalty, and that's a two-way street. I can't expect it if I don't return it. I would go to hell and back for our employees, and I know they would for me. And so you invest, as I said earlier, you invest in your employees. You know, you want them to want to be here, to be part of this. I mean, for instance, in the third building, we're putting a clinic in there, a primary care clinic. It's for our employees and their families. It makes it convenient for them. It's making things convenient and accessible, but letting them know that you really care about them. I mean, you personally really do care about them. And, you know, keeping talent once you have it here, I think, is very important. And it draws a lot of talent. There's several things nationally and also locally here. We team up. We find other companies that may have some resources that strategically help us when we look at bidding on certain contracts, certain types of talent. And so we have teaming agreements where we share with each other, and we also do the same for them. We have resources that they need, you know, and it gives them an opportunity to go after certain contracts. And so we look at that, and then also, I mean, locally here, particularly today with the economy, healthcare is our tier 1 employer, and they provide, you know, very, very good careers. There's doctors and nurses and the administrative people, and we want to make sure, you know, it continues. But at the same time, we talk to each other about certain types of talent, and we may share in that talent. We have doctors that work part-time for us here that are at either Gunderson or at Franciscan Skemp. We work and share talent. So, you know, it's a unique relationship. But why not? Because it's good for the community. It's not just about me, it's about us, it's about the community. So if we working together can help one another, we all succeed. The companies that come here to visit us are wowed. They really are. First of all, you know, it's a beautiful area. They fly in. It's very beautiful with the bluffs and the river, as I indicated before. But it's the quality of life, and they pick up on that. And it's the commitment from the people here. It's their culture. People are friendly, and you know, for a smaller community, it has a lot to offer. As I said, some of the best healthcare in the country. It's right here. Great education. Great education. Wisconsin, Minnesota, Iowa always rank either 1, 2, 3 for ACT scores, whether it's a public school system or the private school system. Cost of living is very reasonable. I know when we talk with the healthcare providers here, and they're bringing doctors here, doctors from all over the world. You know, and again, some of the concern was, how do we get them here? Once they get here, they don't want to leave. They raise their families here. I just think it's a very, very unique area to have a business. We have one of the richest resources in the world, the Mississippi River, right here, recreation. It just offers so many quality things that are part of a good life.